Okay, so tonight we have Dr. Nwizu with us, and she's going to be speaking to us on newsletter writing. I'll do a brief introduction of Dr. Nwizu. Dr. Ucheoma Nwizu received a BPharm degree from the University of Benin, Benin City, Nigeria in 1990. She worked for some time in community pharmacy and global healthcare sector before embarking on a journey to receive a Doctor of Pharmacy degree from the University of Colorado, Skaggs School of Pharmacy and Pharmaceutical Sciences in Denver, Colorado. She is a board-certified ambulatory care pharmacist and currently practices at Neighborhood Health Center, Milwaukee, Oregon, where she serves as the clinical pharmacy manager. In her role, she collaboratively manages chronic diseases and performs comprehensive medication reviews. Okay, she is a certified diabetes care and education specialist, and she has a board certification in advanced diabetes management. She also precepts students in experiential learning in drug information, and some of our students happen to also be in Nigeria. She precepts some students in Nigeria who are experienced pharmacists in their various areas of practice. And I'm happy to say that I'm one of them. And maybe you wonder, really? Well, that is the truth. So this is all about our need to learn, to unlearn whatever wrong things we have imbibed, to relearn new things, and to be ready to adopt practices that will put us in tune with international best practice. So that is what Dr. Nwizu is here tonight to give us the platform to also get into. Dr. Nwizu is also married with 3 adult children, and she brings a wealth of practice to us tonight. So I want us to welcome her and be ready to take in a lot that she has to offer us tonight. So on these notes, we'll be welcoming Dr. Nwizu to please take on the platform, and let us sit back to enjoy our presentation on newsletter writing. Thank you so much, Dr. Nwizu. You are welcome. You have the floor.
Thank you, Dr. Uche, for that nice introduction. Can everyone hear me?
Yes, we can hear you clearly.
Okay, thank you. All right, thank you. So today I'll be presenting on newsletter writing, thanking Dr. Bello for asking me to do this. So we'll spend the next 1 hour just talking about newsletter writing. I think I've been assigned to talk for 45 minutes, and then we'll have the last 15 minutes for questions. So if you have any questions, please either put it on the chat or just write it down and wait till the end of the presentation to ask the question. Thank you. And so we'll start. As introduced, my name is Ucheoma Nwizu, and these are things we're going to cover today very quickly. We're going to cover what is a newsletter, why do we write newsletters, just how do we write newsletters, and how often should we write newsletters. So all of the things I'll be talking about will be in this format. And because newsletter writing is better done, it's not something you actually teach somebody by presentation. But I'm hoping that as we talk, I'll give you some tips, and then you go and start writing, and you actually learn by writing and writing and writing again. So I don't think the didactic lecture is enough for you to launch into newsletter writing. Anyone who knows me and who has helped me present will know that I always start with this thing. What is the difference between a puzzle and a mystery? And a puzzle is just something. It's simple, it's factual, it's solved by getting more knowledge. But a mystery comes with many contingencies, and is solved more by analysis than fact gathering. And I say this because for me, that is something that makes me sit comfortably as a pharmacist among prescribing providers, whether they are doctors or nurse practitioners or anywhere that I am, because I have come to know and believe that the things that we are dealing with are not just factual. It's not that I give you more information than you know. There's just so many, it's almost like looking at an elephant. There's so many angles to it. And so the pharmacist's perspective, because this is a mystery, the pharmacist's perspective is very important. Every year, some guidelines change every year. Every year, there's new things being discovered. No one person can keep up with everything. No one person. So nobody has the corner of knowledge in terms of clinical care. And so because of that, I feel comfortable when I come into this scenario that you may know all of this, but you may not know this. So I am able to contribute to that discussion with a lot of humility, but with a lot of confidence as well. I read this somewhere that pharmacists who communicate well tend to have a greater influence on prescribing decisions compared to those who are not skillful communicators. It goes without saying, but I think I want to remind us also that it's a lot about what we know, but it's also how we communicate it that makes us effective in the things that we do. And so there's lots of things that we do. Anytime a pharmacist puts paper to pen or puts her hands on the keyboard to put out any information, they are doing medical writing. Even if it's a soap notes, it's medical writing. You can do monographs, journal articles, you can review articles, you can even write journal articles. But the one that we want to focus on is the drug information newsletters. And the reason we focus on that is, and especially a lot of us feel that some of the things that like journal articles, it takes a lot of skill. You have to do research. There's just so much you need to put into journal article. Then it's reviewed, then it's sent back to you, and back and forth, back and forth. So that's why people, when they look at their CVs, they brag about how many journal articles they've published. Now, there are people who may not access that journal article. There are people who are at our grassroots level where we don't need all those. They don't have access to just journal articles. So the newsletter is a way to bridge that gap between those highly scientific writings and just things that people need for their day-to-day practice. So today, like I said, we'll be just focusing on this drug information newsletter. I did a brief Google search about what is a newsletter. Is a tool used by businesses and organizations to share relevant information to their network of customers, prospective customers, and subscribers. They give you access to your direct audience, and they are also sharing engaging content. They want to promote sales and then drive traffic to the business. So when I think about the pharmacists in Nigeria, I'm thinking, instead of engaging in the political war, there are things we can just quietly be doing that will advance us a whole lot more than, and let the people who are doing the political war do that work. But as we are as food soldiers, the newsletter is one way we can engage in this expansion of our scope without people really fighting us. And because you can just share your newsletter, you don't need to get any editorial or much of editorial work to get the access to your audience. Sorry, I think I'm advancing. All right. So what are the things? Why do we do newsletters? Because we want to provide timely information that is relevant to healthcare practitioners, like things like changes in clinical practice guidelines, medication safety issues. So, I know that the American Diabetes Association, the GOLD guideline for COPD management, the GINA guideline for asthma management, those change, we bring out new guidelines, I think annually. ADA, I know, does annually. And a lot of people don't know what these changes are. A lot of providers don't keep up with those changes. So when a pharmacist is doing newsletter articles, these are ways to show this is what is happening, this is what is changing, this is how people are, the experts are seeing things now. You can write on medication safety issues. If there are any things that you have noticed that are concerning. I remember there was one time a WhatsApp article, WhatsApp writing was going around about people using paracetamol to soften meat. I don't know if anybody saw that. It was just everybody was saying, don't buy meat that is cooked in restaurant because they're using paracetamol to soften meat. And a lot of people read that. But if a pharmacist sits down and thinks through that, what is a pharmacist's response to that? Because number one is making people not to buy restaurant meat. Restaurant people are losing their customers, and there's a lot of fear in the area. So how does a pharmacist address that? That's a newsletter article. It requires investigation, it requires research. How does paracetamol really soften meat? How much is needed to soften meat? And those are things that are relevant to in an environment that we can write about. Are there new drug approvals, or are there medications under development that you think that people need to know? Are there medication shortages that people need to know? I remember when there was some talk about, I think it was the ARBs, losartan, was it lisinopril, and all the ACEs and ARBs that they said was causing cancer. How does a pharmacy respond to that? If you do a drug class review, now that we're having new medicines for diabetes, the SGLTs are available now in Nigeria, the GLP-1s are available. Can somebody talk about all of them and see which one is better? If you do a medication utilization review, so if you are looking at prescribing patterns and prescribing habits in the hospital, if you notice a pattern, can you do a drug information article on that? It's a newsletter that you write to your local community, and it helps people with the information that they need. So in the hospital, people can write newsletters as ways to communicate P&T committee decisions on drug-related topics. It may, some places, be required for compliance and legal accreditation. The target groups are usually patients. Sometimes are usually patients. Other times we can target the physicians, the nurses, or other healthcare staff. And sometimes we tend to try to focus our attention on the physicians, not knowing that even the nurses or dietitians, there are areas in which we overlap, that we can provide newsletter articles that will help their practice, and they will appreciate us more. In the community, community pharmacists can write a newsletter to the patients and the general public, write newsletter to the physicians in their area, write newsletters to organizations, even to the government, where you put an op-ed in the local newspaper about something that you see that is concerning. One of the things that I've noticed that really, really does outlast us as human beings is writing. I mean, there are people who are dead that I'm reading their works today. So for people who are concerned about, their legacy, or people who are concerned about doing work that really outlasts their life, writing is one way to go. So we'll move on to how. So how do we write newsletters? And I'm going to be mindful of time. If you have any questions, like I said, let's wait till the end. But I'll try and be as quick as possible, so we can have time for questions. And so how do you do this thing called newsletter? The first thing, first things first, you want to identify who is your target audience. What type of information do you want to share? What is your capacity? Do you want to do just a one page? Do you want to do two pages? Do you want to do multiple pages? And what is your timeline to write? When you put all this together, you make a few decisions. What is your target audience? Is it the patient? Because the language you use when you're talking to a patient is different from the language when you're talking to a physician. Is it a nurse? Because the language also is kind of different. Is it the dietitians? the language is also different. Are they, you know, what type of information do you want to share? Do you want to go in depth into, there's some topics where you want to go in depth and look at even primary literature. There are some topics where you just a surface look at the problem is what you need. Newsletter capacity, I personally, and it's my personal preference to just keep my newsletter article to just 1 page. And the reason I do that is, having studied my own target audience, which is the physicians in my practice, they don't want to read too much. They just want to give it to me straight, give it to me factually, let me go. They don't, when you get them into too many words, they just abandon your work. So having understood that, I'm just like, you know, I just give it to them straight. And what is your timeline? You know, as in, I think what I really mean by timeline is how often do you want to be producing this? So if you have a newsletter that you're doing quarterly, maybe you can do more than a page. But if you have something that you're doing monthly, a page is reasonable to just give every month. So deciding that is, it helps you determine what, you know, how you arrange your thoughts. Still on target audience, still there are multiple ways to write. If your target audience are physicians and your fellow pharmacists, you're going to be using a pure technical style, meaning all your language is, you know, like very clinical. You're not, you know, you're very clinical in, you know, your descriptions are clinical. You're not going to be using layman's terms. Your writing is formal, and when I mean technical is like you want to do, when you say things like I'm trying to think of a clinical big word, peripheral neuropathy. Every doctor understands that. When you want to say things like I'm thinking, what are those big words that we use that people don't know what we are talking about? But, you know, all those big clinical words you can throw around when you are describing, writing to clinicians. And so that's pure technical. There's also a different level of pure technical. Let's say you're writing to your fellow pharmacists. There are things that we use in pharmacy language that even the doctors don't understand. I'm trying to think of some of those things, but I'm thinking, I'm sorry, I can't remember, but as you're thinking, think about words that are pharmacy, pure technical pharmacy words that if you told a doctor, they're like, you know, like when we say things like med reconciliation, we know what we are talking about, but the doctor may not know what med rec is. So if you write medication reconciliation, you may need to define what it is and explain it. Don't assume that they know. I remember a doctor told me, maybe the meds are fighting and you want to make peace with them, but you know, we know what med rec is. So that there are terms that are pharmacy centric, so be mindful of that. Avoid general slangs like LOL, OMG. I'm sure that is goes without saying. If you're writing to people who are of the same technical background, but then different clinical exposures, like if you're writing to dietitians, in my clinic, we have dietitians, we have behavioral specialists, and we have nurses, then I am going to be mid-technical in my, you know, in my language. And so if I say something like peripheral neuropathy, I would, you know, kind of explain it. So because you want the behavior specialist to understand. If you're writing for lay people, then your style is going to be popular technical. You're going to use common language. In fact, the rule that we have for our students is that if they are writing a material that lay people are going to read, they must make sure that a sixth grader can read it. So somebody who is in primary 6 should be able to read and understand what you're writing. So you won't be using things like peripheral neuropathy. You can say things like numbness in your hands instead of peripheral neuropathy. Instead of saying cardiovascular risk reduction, you can say reduce your risk of a heart attack or stroke. So you have to bring it down to lay people's language when you're writing. But all of these types of newsletters are very valid and very useful. So the fact that you're not writing to patients and not doctors does not mean that your newsletter is of a lower standard. You're communicating, and you have to feel proud of what you're doing. All right, so moving on. So who are your target audience? You must always put yourself in the reader's position. What if I'm thinking like a physician, what do I need to know? So, you know, how do I want it to be presented? For instance, like I know a lot of our physicians, they have so many materials flying out at them. They are reading this, reading that, and they just, you know, they just like, would you just give it to me straight? Don't go to just, you know, your point has to be straight and, you know, don't lose your point in your words. What is their reading habit? Are they in your organizational politics? So especially, and this comes also, especially if you are in choosing a topic. You know, if choosing a topic, especially when you're starting off newsletter writing, if it's going to rear discord or political discussions, maybe you should avoid it. I'll give you an instance. One of our providers did a presentation about metformin and lactic acidosis. We had a patient who had lactic acidosis, which is very, 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 very rare. But she did a presentation and about the patient case and how we should be careful about prescribing metformin. The reason this lady had lactic acidosis is that they were drinking, and they also had, so they had cirrhosis, drinking, already having cirrhosis, and had a kidney failure. So they were in lactic acidosis. However, that presentation kind of scared a lot of the providers from prescribing metformin. I wanted to write a rejoinder and say, you know, let's dispute this. This happened, but it doesn't happen often. And my boss said, you know, let's just let this lie down for a while, because, you know, she has her combat boots on. Even though you have a point, you don't want to engage in that manner. So we'll wait till another time, maybe 2-3 months, and then readdress that. And so that's what we did. So you want to make sure that your newsletter article does not, your purpose is to educate and not to stir, you know, controversy. And so, sorry, I have to move this so that I can see my slides. Okay, all right. So, before you start, you have to do your research. You have to obtain peer-reviewed articles, your guidelines. Make sure you do a thorough research. Sometimes you may need to research on other things. For instance, like when I talked about people using paracetamol to soften meat. If you want to write about that, you can look at your peer-reviewed articles, all right, but you want to know what is really happening in your community. Are people really, really using you know, paracetamol to soften meat? And if they do, where did they get it from? You know, and then so you can educate people better. So in writing a drug information newsletter, you want to, I'm going to be talking about the different, you know, sections: the topic, the introduction, the body, the conclusion, and your references. So we'll go with the first one, the topic. You know, I think I mentioned it a little bit earlier, things you can write about. Is there a new medication? Is there a new NAFDAC policy that you think people need to know about? And how does it affect your local community? Are there guideline changes? Like I said, there are guidelines that change every year. For instance, I think the beer criteria, if you all know about the beer's criteria, they came out with a new criteria. I think I saw it 2 weeks ago. And so I'm going to have to look at it and see if there's something new I need to address for our providers. If you are doing medication utilization reviews and you notice that there's an issue coming up, for instance, how many patients who are supposed to be on aspirin are on aspirin? How many patients who are not supposed to be on aspirin are taking aspirin? Those are things that can make you want to write about aspirin use in your community. Are they drug information questions? So what kind of drug information questions are you getting? And are they questions that you can turn into a newsletter article? Are they prescribing trends that you see? For instance, people who are using omeprazole and PPI, that is supposed to be a short-term 3 months use. Noticing people are on omeprazole for 2 years, 3 years, especially if they're older. You can write on current controversies, but I'd like to say, until you get comfortable, don't do that. The kind of controversies that I've taken on in the past is how low is too low for cholesterol, or what is the true blood pressure goal that we should be going by, because different guidelines have different goals, and how do you choose one? So those are controversies, not, but don't go into things that go into political fight, because number one thing you want to do with a newsletter is to gain trust. The newsletter helps you gain trust. And so if you start off fighting, you lose that battle. You want the topic to be catchy. You make it catchy. You want people to look at it and say, what are they saying again? You don't want to give a topic that people are, here they go again. They have to want to read what you are saying. So make sure your topic is catchy. Focus on pharmacotherapy. That would be things like appropriate medication use, even treatment goals, like I talked about blood pressure goals. These are pharmacotherapy topics. Venture away from topics that are strictly pharmacy centered, especially if you want to sell your market to people who are not pharmacists. So don't choose topics that engage them, not topics that you pharmacists are talking amongst yourself. Patient cases make good topics. Avoid topics that discuss diagnosing, because you're now creeping into the scope that is not really clinical pharmacy. All right, so these are examples of some of the, when I say catchy topics, these are some of the topics that we have written in our organization. We wanted to address the use of inhaled corticosteroids in COPD, and I have inhaled corticosteroids in COPD to use or not to use. People want to say, okay, what are they saying? Should we be using it? This is the second one, the many sides of pioglitazone. When we found that pioglitazone had some cardiovascular benefits, we wanted to talk it. I'm like, people know pioglitazone as an old drug. Everybody has been using it. And what new do you have to tell me about pioglitazone? So they will read it. This one is a patient case, Casey and the diastolic J curve. I wanted to talk about this, and I made it in such a catchy way that they want to read it. And the patient case, diabetes and blood pressure goes lower is better. So I try to make the topic catchy so that people want to, like, what are these pharmacists saying again, and not just wave it off. So moving on to the introduction. You want to start strong. In your introduction is where you present your case. What is the problem? What is the current state? And what is the problem? And why is it important to address this topic? What is the objective of this article? So that first paragraph wants to catch people's attention still, and then, it has to be straightforward, so that they can catch people's attention, and then you move on. When you're doing your introduction, the 4 C's, it has to be clear, it has to be concise, it has to be you have to be confident in your writing, you have to be courteous. Confident is not about you. The newsletter is not an opportunity to show what you know. The newsletter is an opportunity to provide information to people. And even though they may be the same thing, the attitude with which we approach the newsletter article is different. So if I want to show up that I'm telling you everything that I know, but if I want to give you information that you need, then I'm mindful of who you are, what you're doing, and what you need for the next thing you meet. And you have to be courteous. Needless to say that, because I know we are courteous in our approach. All right, so this is a sample paragraph when I'm in trying to talk about concise and being straightforward, and also making sure that your first paragraph is talking about what you want to address. So I'm giving you two sample introduction paragraphs. This one is inhaled corticosteroid in COPD, to use or not to use. And I'm writing, COPD is estimated to affect 7.5% of Australians age 40 and above. COPD is the 5th leading cause of death in Australia. And I'm talking about how many deaths per 100,000. The financial impact of COPD in Australia is calculated to be in excess of 8 million. And I'm talking about how many 7 billion is lost in productivity, welfare. COPD exacerbation can be defined as a sudden change from baseline in the patient's key COPD symptoms. And all that, and all that, and all that. I'm writing all that. So this is the first introduction. Now look at the next introduction, can compare. And tell me which one addresses my topic. So COPD is one of US top leading causes of death. It remains a global health challenge and is estimated to surge in future decades due to consistent exposure to COPD risk factors and overall aging of the society. And I go on to say therapeutic management of COPD continues to be a challenge. Current medications available for COPD largely do not modify the disease course. When inhaled corticosteroids are while they are the cornerstone of asthma management and the most effective therapy, determining when to use ICS in COPD is still challenging. And I write about what guideline is talking about ICS using COPD. So comparing the two, both of them are speaking English, both of them are talking about COPD. Which one do you think is a better introduction?
The second one.
The second one, yeah. Because I'm talking about COPD inhaled corticosteroids to use or not to use. In the previous
second one.
Yes, second one, yes. In the previous one, I'm talking all this thing about how much money people are spending. I now go on to talk about COPD exacerbation. That is not a good introduction paragraph. But the next one talks about, this is a big problem, is the sixth leading cause of death, is global, is getting worse, but it remains a challenge. And I go on to talk about ICS, the use of ICS and what the problem is. So the second one is a better introduction than the first one. So moving on to the body, that's where when you talk about that COPD and ICS, that's when you now go and start talking about the details of the use of ICS in COPD and the problems, the side effects, whatever you want to talk about it. So it contains the details. We want to keep one idea per paragraph. You have to keep your eye on the desired endpoint, because sometimes we find that in talking about COPD, we can veer into asthma, but is that what we want to do? It may be true that but you want to make sure you keep to the desired endpoint. Don't stray from the subject unless it is necessary, and keep your paragraphs, keep a logical flow. Don't skip back and forth. So sometimes I see people write about the therapy, then side effect, and then they start again about the therapy. You want to talk about ICS use, then you talk about side effect, then you talk about ICS use, pharmacotherapy. And that, you want to make sure things are logical. Logical means finish talking about all your therapy discussion, then you can talk about the side effect, then you can talk about the cost. Make sure that there's a logical flow, because people's brains, you have to understand that, the readers, when you are jarring people's brain back and forth, they lose information. So be mindful, make sure things are logical so that people don't get cross-brained. You can be creative, meaning that your writing doesn't have to be boring. It can be entertaining. You can slip in a joke there. You have to be careful though, because this is a professional writing. So when I say entertaining, I'm not saying be casual, but you can slip in, sometimes you read something that is clinical, but you find yourself smiling because this person just slipped in a joke there. You can be creative. And then most importantly, do not have any identifying patient information on that newsletter article, especially if you're using a patient case. And also do not have an identifying physician or practitioner information there, because you don't want to, even though, if people know that this is the person that did that, then, you don't want to do that. So you try to make sure that people cannot tell if you're talking bad about a physician. I wanted to, a paragraph is a collection of sentences that relate to a common theme. And I want to stress this because what I see in when people write a lot is that in a paragraph, they have multiple ideas in one paragraph. It's very confusing, you know, so yes, you have to make sure that your idea is one idea per paragraph. Flesh out that idea before you go on to the next one. Like I said, be considerate. Think about your reader. Always remember you are writing not to show your knowledge, but to make sure to help the reader in their next steps, in their knowledge and their skills. And be professional. The document should look presentable. Make sure that you're using the same font shape and the font size as you're writing, because once the eye sees it first before the brain sees it, and if there's no uniformity in fonts, you lose information that way. So one of the things that I wanted to bring out is to using active versus passive voice. So it's recommended that in writing that you use active passive voice. Now, and I know that in your mind you're thinking passive voice, but you want us to be strong. So I hear a few statements and you tell me which ones are active and which ones are passive. So active is when you write in first person with the pronoun. So meaning you want to identify who did that versus, you're just making a statement. So the patient was initiated on a statin. We initiated the patient on a statin. The patient should be initiated on a statin. Then the next final one is initiate the patient on a statin. So between these four sentences, which one do you think is the passive voice? So the passive voice is not pointing a finger at anybody. The active voice, yes, the active voice points a finger. The passive voice does not. I'm listening.
Which one do you say we should identify?
Identify which one is, identify the passive voice.
The first one.
Yes. And then any other one?
Hello.
The last
third one.
The last one.
The third one.
The third one. So
the third one.
The passive voices are the patient was initiated on a statin and the patient should be initiated on a statin, because you're talking, it's almost like you're talking to people, but you're not pointing a finger. I know, when I was working in Nigeria, when we write prescription labels, we say 2 tablets to be taken 3 times a day. Remember that? I think we still do that.
Yes.
2 tablets to be taken 3 times a day. I remember the envelope.
We don't do that.
You don't do that anymore?
Yeah, we don't do that.
Okay, why?
Because it's not specific.
It's not specific.
When you
So
say
what do we do now?
3 times a day, the patient can take it within a 3 hours interval. But when you once you say 8 hourly,
okay,
the patient will take it every 8 hours.
Every 8 hours.
So
Okay.
when you say 3 times a day, you're not specific.
You're not being specific. So when we say 8 hours, do we say 2 tablets to be taken every 8 hours? Or do we say take 2 tablets every 8 hours?
Take 2 tablets.
I think we fluctuate in between.
Yeah.
Okay, we fluctuate. I remember in our training in Nigeria, they say we should say 2 tablets to be taken every 8 hours. And they said not to do that because we don't want to be seen as giving the patient instructions.
Yes.
I remember learning that in pharmacy that you don't, because especially if, let's say, you're now dispensing this medicine to a man who is older than you are, and you say take 2 or 3 tablets every 8 hours. They look at it as, you small girl, you're giving instruction to this old man. They may not take it. And I always wondered why, you know, I don't know. But when I come into the US, we say take 2 tablets 3 times a day. Nobody is caring about whether you are using an active or a passive voice. I am just saying this to bring out this difference between active and passive voice. You know, the active voice is pointing a finger and give, you know, like, you do this. The passive voice is kind of, this should be done. It's not direct. And in most writings, they advise that we use the passive voice so that you are not pointing a finger. Now, lately, there's been some controversy, like whether you should use an active voice or passive voice, but I tend to, in my writings, prefer to use a passive voice, just so that I come out more, to me, it sounds more professional, but the jury is still out there. I've stressed this, the 4 C's: clear, concise, confident, and courteous. Concise as in long as necessary, short as possible. Eliminate what is not of importance, and don't even write what is of secondary importance, and make sure you keep an eye on what you're trying to say, because it's easy, especially when you're writing a newsletter, because you are doing research and finding out new things. So what you're doing, what you should be doing is, all these things I've just learned now, I didn't know this, I didn't know this, I didn't know this, I didn't know this. What does the person I'm writing this newsletter for need? So you are not going to, you know, you get a lot of information, but you have to always think, what does this person need? So that you're not kind of just transferring all the things that you've just learned to somebody who may not need it. I'm going to skip this, these 2 slides. So the conclusion you should place at the end of the body should logically follow from the information presented, should summarize everything. You should not be introducing new concepts in the, you know, if you haven't talked about something in all the other paragraphs, don't come and start talking about it in the conclusion, because it's like you're just throwing in something now that, you know, that is different from all the things you've been talking about, and you don't have the time to expatiate on that. Should end strong. So start strong, end strong. Start strong, end strong. This is an example of a newsletter that I think that we wrote and it was based on a patient case. We wanted to talk about the lower versus higher blood pressure goals, because the new ADA guideline had come out to say, let the blood pressure goal be less than 130/80 instead of 140/90 that we've been using. And so we wanted to discuss the, you know, number one, what's the evidence for that recommendation, and we decided to use a patient case to buttress that point. I typically use patient cases because they kind of, you know, it's almost like they bring things home, and it makes you not sound like you're talking theoretically. When you're using a patient case, people can picture the patient and the learning is better. I'll be sharing the slides with everyone, so you can look closely at this write-up. And so the last thing I want to talk about is references. And I wanted to call out that because my newsletter article, I send it out monthly, and so I keep it to just 1 page. And you see in this particular write-up, I have 8 references. Because I don't want to crowd my newsletter article with so many, like all those things, I just keep it simple. I just quote I don't write the name of the article or the, you know, the authors of the article. I'm just the journal and, you know, the journal edition and all that. I do that for newsletters, and I keep it simple because I don't want too many. I need my white space. I don't want my references to crowd it all out. So this is as opposed to having everything. So if I had to write all these things down in my newsletter article, then I would lose a lot. I mean, I wouldn't have, my page will not be enough. So I just keep it simple. The last thing I want to say is edit, 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 and just not you editing. Make sure when you're writing, you have 2 or 3 other people who are looking at your write-up with you, because number one, they help you keep things simple. You may finish editing and it still doesn't look, somebody might still find things to correct. For me, I edit, send it out, edit, and then I print it out and look at it in paper and like, how does it look? I edit again. And, before I now send it out, I edit again, because you always find opportunities to simplify things, and use 2 or 3 other people in your establishment to make sure that you are doing good edit work. And of course, you know that Microsoft now has spell checks and all that to help you with your editing. How often? It depends on your capacity and what you can do. I'll tell you, my personal story is that I started writing weekly. Then it became too much. I changed it to bi-weekly dose. It became too much. I'm now clinical tidbits, which I am keeping to once a month. I didn't want to tie myself to a timely, I didn't want my newsletter title to be something that tied me to a time, so that if I don't give you the news, you won't say, oh, she's defaulting. And then what is the demand? What's the demand in your organization? So anything from weekly to monthly to quarterly, you may want to write. So these are the rules. Do enough research before you start. Start strong, put yourself in the reader's position, use proper grammar, spelling and grammar, be creative. The document should be presentable. I have this acronym KISS. Keep it simple, stupid. Keep it simple, simple. Avoid using abbreviations or acronyms. Don't write to me with that tone of voice. I say that to say don't. Make sure you're courteous. Give credit when it's due. Mini cite, end strong, and then of course edit. And I have this, having done all, then stand. I put this here because when you first start writing, you may not know that how much is impacting people. You may not, people, no news sometimes when you're writing is good news, because people are reading it, and one day you find out that you have helped people with your write-up. And I didn't find out until in fact, the first person that told me your write-up has been helping me was a physician that was leaving the practice. And he sent me an email saying, I want you to know I'm leaving, my last day is today, and but your write-up has been helping me with this. They don't usually say that, so when in those times, just keep writing, having done all, just stand, I think we are 2:03. When should I be stopping? A writer is someone for whom writing is more difficult than it is for other people. I want to let you know that nobody finds writing easy. Some people do, but most people who write just write. I personally grew up in Nigeria, and I don't know whether you all have this mindset, but in growing up, you're either science inclined or you're art inclined. If you're art inclined, then you write. If you're science inclined, you just do math. You don't have time to write in long essays. So I grew up just not thinking that I was a writer, and I got the exposure to start writing when I went to do my PharmD. And in one of my experiential learning, they told me to write an article every day for 6 weeks. I'll write some every day. And that's how I launched into writing. And it was something after that, I've just been writing ever since. Everywhere I go to, I take up the task of writing because I guess maybe to make up for my past of never writing. I just did my math and calculated and wrote the chemical formula, and I didn't think that you could be science and be a writer. I never thought that. So it doesn't have to come easy, but it gets easier as you do it more. the best way to become a writer is to go off and write. Just keep doing it. And these are my references. I will want to take time to respond to questions now.
Okay, thank you so much, Dr. Nwizu, for that robust presentation. It's always a joy to listen to you teaching line by line, precept by precept, making it easy to soak it in, giving us hands-on. So thank you so much. I'm sure that we have been thoroughly enlightened and impacted by our presentation. So we would like you to indicate if you have questions tonight. We're looking at being able to give room for 3, 4, 5 questions because of our time. So kindly indicate by raising up your hand electronically, and we would acknowledge you. And as we are trying to do that quickly, I'd like to recognize some of our guests tonight. We have in the house Professor Bola Jokwaino. She has been part of the meeting from the time we began. She's a professor in the University of Lagos Faculty of Pharmacy. She's been a one-time dean of the pharmacy department. We'd like to welcome you here tonight, Ma. We also have with us Dr. Afusat Adeshino. She's chairman, HAPS, Association of Lady Pharmacists. You are welcome. Thank you for joining us. We have in our midst also Dr. Dr. Joseph Ole, who is the chairman of SIPAM Pool of Experts. We like to appreciate you. Thank you for joining us. We also have our erudite Secretary of SIPAN National, Dr. Mutiat Olulawal. Thank you also for joining us tonight. So I would like us, I'm yet to see any indicators for questions. I can't see any hand being raised up. Is it that it was so simple that there is no question to ask? I can read some of the comments anyway. Okay, I'm just seeing one hand coming up. I can see pharmacist Ikide. Can you please unmute and let's hear your question? Let's keep our questions straight to the point and brief. Thank you so much.
Thank you very much, Ma. And thank you, Dr. Nwizu, for the elaborate presentation. I just asked in the chat box that could she share the reference, the reference she used to elucidate this interesting and concise guide to writing newsletters. It was the last slide, so I just wish she could share it in the chat box so I could copy it and probably read more about it some other time. Thank you.
Okay, thank you, Pharmacist Ikide. I'm sure Dr. Nwizu will be ready to do that. And as we usually do, I'm sure she will share the slides and we share on our platforms. So I can also see, Dr. Nwizu, do you want to respond to that, please?
On the reference.
Yes, please.
Yes, I can share what I have, but I think there are 1 or 2 references that I didn't put on that. So can you, Dr. Ikide, how can I send it to you? I'll put all the references, and I think I didn't share the reference from the book, drug information book that I used. I think it's not listed. I think that reference just that to that quote where I said pharmacists who communicate well a better impact prescribing than others. So I forgot to add the other reference. So I have two more references I want to share with you, if you don't mind.
Okay.
Okay,
thank you so much.
I'll share my email in the chat box. Thank you, Dr. Nwizu.
Okay, let's see your email.
Okay, so
okay, thank you.
We also have a pharmacist, Olabanji, raising your hand. Can you please unmute and ask your question?
Good evening.
Yes, how are you?
Please go ahead and ask your question.
Okay, my question is that is there any particular format or guideline in writing a newsletter as a pharmacist? Thank you.
So I don't know of any particular format or guideline. We do have formats and guidelines for writing, for medical writing generally. And so for me, what I do is apply it to newsletter article and also apply what do I want to say. And so, like I said, you do the introduction, you write the body, you get your conclusion, and you make sure you put your references. That's the usual format for most write-up. But because I try to narrow it down to, okay, this is what I want to communicate. It's just one topic. I'm not writing multiple things. I'm just keeping it this simple. I don't know if that helps. I know that we had, Dr. Bello, if you can help with this, we had shared the book, the latest edition of Newsletter Drug Information. In chapter 13 they focused on professional communication. You'll get a lot of tips from that chapter 13. Dr. Bello, if you can share the book again on the platform. Yeah.
That will be shared. Yes, the chapter will be shared after the meeting.
Okay.
Right?
Yeah. Chapter 13 covers medical writing.
Okay, it will be shared. Okay.
All right. Thank you.
Okay, thank you, Dr. Nwizu. The last person tonight is I saw pharmacist or probably the question pharmacist somebody was raising up.
That's pharmacy Wole Ogunbamiru.
Okay, pharmacist Wole, but it's like he's no longer on the call.
Okay, audio. Okay.
It's like he's gone off. Okay,
yes.
but generally, there is a request for copies of the slides. So I think as is our pattern, we would share on the platforms after we're able to get the copy of the slides from our presenter. So I think we should all just wait for us to do that.
I see a question here that says, if your newsletter has 3 or 4 points to pass information, how do you keep it fresh from telling your audience what they might already know? How do I keep it fresh? So the things I write about in the newsletters we write about assumes that because I'm writing to physicians, so I assume that they know a lot. I'm just either calling out something as a reminder or and then adding something new. So I'm never afraid to say something they already know. For instance, when I talk about COPD being the leading cause of it's, they already know that. When I talk about ICSUs in asthma, they already know that, but I'm trying to call out something new. So some of the paragraphs will be like reminding you and forming a base for us to leap into the new information that I'm sharing. If you look at in the slides, the article that I shared on the slide that talked about blood pressure goal, I talked about what the JNC 8 said, which they already know. I talk about what the ACC/AHA guideline says, which they already know. I talked about the spring trial, which they already know. But then I have added information because something made the ADA change the goal from 140/90 to 130/80. All along, the science had led us to believe it's 140/90. What is the new information? And so that's how I think I keep it fresh, because know this, but this is something new that I'm introducing to the discussion. And the things vary. There's just an endless, from patient cases to new guidelines, situations or guidelines, there's always something new to you know. And then the other thing too is that we also have a high turnover of physicians. So they may know it, they may not know it. If they know it, you're reminding them, but you know, you're also introducing something new at the same time. So that's the question that I see.
Okay, there's another question. It says, can we have copies of the prototype or newsletter used in the course of the training? So that's Dr. Nwizu too.
We can share that. We can share that, definitely share that. And I was also going to share, when I have some students that I am precepting in Nigeria who are writing newsletters, as they write, I'll be sharing on the platform too, so that we all know.
Okay, thank you very much.
I see another question on the chat. Any possible unexpected experience encountered at the inception of providing newsletter at your organization? Not really. I think for me, what is unexpected is the fact that people were reading it and it was impacting, you know, I thought I was just writing, but you know, people were reading it and it was impacting care. Now, one thing that was unexpected, when I did a 2 or 3 years where I worked in Nigeria between 2008, 2012. And in the organization that I was working in, I was writing newsletters. I think it was quarterly. Now, the unexpected turn that I saw was because I was the only one who had consistently been putting out information, and it was HIV care, so things were changing. I was the one person who was consistently putting out new information for the physicians. Now, the surprising thing that happened was that after I left, when they were now going to interview people for promotion, they pulled out my newsletters and they were asking people questions based on the newsletter articles I wrote to see who was following up. So the establishment noticed that this was valuable information, and they were using it as criteria to know who was updating their skills in HIV care, which I found, which was unexpected, surprising. So I have had more positive surprises. I haven't had anything negative, and I don't know why nobody has said anything negative. But one thing that I will say that is that even when, you know, it's been the silent, one thing that has advertised pharmacy practice in our organization, like you have a bunch of knowledgeable people who can help you guide therapy. And so for providers or physicians who have not been accustomed to working with pharmacists, it's that thing, when they come into organization, we keep dripping that we are here, we are knowledgeable, we can help you guide therapy. So thank you.
Okay, thank you so much, Dr. Nwizu. I think it's been a time well spent tonight. I have been impacted, and I want to believe that every one of us has been impacted. So, like she said to us, having done all, stand, okay, so, and before that, it was, whatever you have learned, start writing. The best way to start off is to start. So start writing. So I'm expecting that a lot of newsletters will begin to go forth in our various areas of practice. And she already told us that it's one of the ways that we can create awareness for pharmacists in our facility. Let's kind of put it in the face of other healthcare workers that we are there and we have something to contribute. So it's a good one, and we are looking forward to having a follow-up on this, and not just this topic, other areas that Dr. Nwizu can help to build our capacity. So we want to appreciate you tonight. We thank you so much for your time. We thank you for your interest and the passion that you have to impact the practice in Nigeria, despite the fact that you are in diaspora. So we appreciate you. I would like to welcome comments or parting words also from Dr. Ibrahim Bello, the Deputy Chair of Drug Information Specialist Group. Over to you, Dr. Bello.
Okay, thank you, Dr. Joe. One thing I want to add to this is that writing this newsletter in Nigeria comes with a cost, because if you work in a teaching hospital, you will pay for the designing, and you only want to have hard copies. So I want to tell us not to be discouraged, because you may not get funding, but if you are desired, you have that desire, the burning desire to do that, you may carry on without any hindrance. So we have to, the cost of designing and printing may be discouraging, but I'm telling us not to be discouraged. That's my own contribution to that.
Can I add something to that? So one way to mitigate that is to maybe designing. There are many free design templates online you can use, but printing, you can just print one copy and put on the notice board, and put maybe 5 copies and put in strategic places. People who read it are going to ask for it, and you're going to ask and send them soft copies. So you can send it to their WhatsApp phone, their emails. But we can be strategic about how we share without incurring a lot of cost, because I know cost is a barrier.
Okay, thank you for that information.
Yeah.
So overall, on behalf of the, okay, can I go on? Okay. Okay, on behalf of the Drug and Pharmacists of Nigeria, we want to sincerely thank Dr. Nwizu so much for honoring our invitation and for this very informative and engaging lecture on writing newsletter. I know, like Oliver Cheese, we want to say that we are still going to invite you on other things on medical writings. And you mentioned writing monograph, writing drug bulletin, writing drug review, and many others. So one of these days, again, we're still going to invite you. So we hope we have all learned a lot. And we want to thank all the participants, especially the 5 people on the call, and everybody for your time shared with us. I hope we apply all the knowledge gained in our various places to improve patient care. Thank you, and God bless us.
Thank you.
Thank you so much. So on this note, we'll be ending the meeting.
Yeah.
Dr. Nwizu, I can see your hands are up. Do you want to say
bye-bye
something? Okay, so let's all say bye-bye to Dr. Nwizu.
Bye-bye.
Bye-bye to one another. Have a wonderful good night rest and enjoy the weekend. Look forward to seeing you again. Thank you all. Bye-bye.
Dr. Nwizu, thank you so much. Good night.
Bye.
Good night.